episode 2 of common mistakes that women make when they are trying to get pregnant. In these episodes, I run you through some of the things I have come across, and as a doctor, I'm thinking, how is it that you've been trying to fall pregnant all these years and you just did not investigate these, and therefore you've wasted all this time whilst trying to get pregnant, and all it was is this simple thing. Well, at least for me as a doctor, that they were simple and should have been addressed ages ago. You didn't address, and you are now 5, 8 years down the line and you are still not pregnant because you haven't done this. Hi, Dr. Kady. This is HeyDoc. Here we do fertility medicine and women's health and other topics at times, because after all, I am a board certified family doctor. So if these topics are your thing, do remember to smash the like button and to subscribe before you leave. And if you've not watched episode 1, after watching this video, you know what you need to do. Go back and watch episode 1. So, ladies and gentlemen, let's talk. One of the things that I see over and over again in my fertility consults are some of the underlying pathologies that women who are trying to fall pregnant just have not addressed. The first kind of pathology is the type of growth that happens within the uterine cavity, particularly uterine fibroids. Let's look at the first one, uterine fibroids. Now, countless other women who have had uterine fibroid decade after decade, century after century, who have been able to get pregnant and have had successful pregnancies and delivered healthy babies. Sadly, though, that success story is not the case for every woman who has a fibroid. Ladies, the kind of uterine fibroid that you have actually matters. So I made a previous video about how you can fall pregnant despite having uterine fibroids. So it's well worth a watch. An important take-home message that I discussed in that video was about when you are told that you have a uterine fibroid, one of the very first things that you need to find out from your doctor is, doctor, which kind of uterine fibroids do I have? If you are told that you have a subserosal or a intramural fibroid or a pedunculated fibroid, these are fibroids that don't necessarily interfere with your fertility. However, what would be considered to be bad news from that consult is if your doctor tells you that you have a large submucosal fibroid. Why is that? Well, because this fibroid tends to be found directly adjacent to the endometrial lining. And if you followed me on this channel, you will know the importance of the endometrial lining. I've done videos about the anatomy of the uterine cavity. I've also done videos about the menstrual cycle. In those videos, you will understand why a healthy endometrial lining is everything, especially at the early stage of the process of getting pregnant. But just a quick rundown for those of you who are watching this video before watching those other videos. The endometrial lining is where the fertilized egg, otherwise known as the zygote, will then come and implant itself. So if you have a submucosal fibroid that is just sitting right underneath the endometrial lining, as the fertilized egg is implanting itself into the endometrial lining, it will come across the fibroid that is sitting underneath the endometrial lining. So this fibroid will interfere with implantation. And in the instance where the embryo does manage to go through the first stage of implantation, it's unlikely that this implantation will result in a successful pregnancy because the embryo will not be able to successfully anchor itself into the endometrial lining and get the support it needs throughout the pregnancy because of the presence of this submucosal fibroid. So if you've been trying to fall pregnant for any length of time, so again, one of the things that you want to have made sure that you have had done early is an ultrasound. The ultrasound will be able to pick up the fact that you have a fibroid. It will then be up to your doctor to assess the ultrasound images and be able to say you have this type of fibroid, and so therefore this will not affect your fertility, or that you actually have a submucosal fibroid, which is actually most significant when we talk about how fibroids can affect your fertility. Also, another uterine cavity pathology is multiple polyps. So these polyps are usually fluid-filled sacs, or rather small sacs that can be found in one position of the uterine cavity or multiple positions of the uterine cavity. The ones that matter the most are when you have lots of endometrial polyps. Under those circumstances, these can also sometimes interfere with implantation. Endometrial polyps can be removed laparoscopically. Just before we move on, let's go back to fibroids, uterine fibroids. If it is found that you have multiple submucosal fibroids or a very large submucosal fibroid, remember that's the main one that will affect your fertility, you need to have a discussion with your doctor, particularly if pregnancy is just not happening for you, or you are having recurrent miscarriages. You and your doctor need to have a serious discussion whether it might be worth removing these submucosal fibroid through a procedure known as a hysteroscopic myomectomy. Another pathology that you must make sure that you do not miss is having blocked fallopian tubes. Listen, ladies, your eggs may be the most healthy and the most beautiful egg that have ever existed on planet Earth. You know what I mean? Anyway, jokes aside, your ovaries might be very healthy and everything else to do with your reproductive system might be very healthy. But if you have blocked fallopian tubes and you are trying to fall pregnant naturally, you have nothing. Forget it. It's not going to happen. Why? Because there is no way that the egg that is being released from your ovary will be able to travel and sit into the fallopian tube whilst that egg waits for a sperm to meet it in the fallopian tube and for fertilization to happen. Because it's blocked. There is no way that the egg is ever going to be able to get in. So ladies, save yourself the distress, the depression, the tears, and the strain that it might put on your relationship by finding out early what the health and the state of your fallopian tubes are like. On this channel, there are 2 videos relating to fallopian tubes. One that talks about all the different causes that can lead to blocked fallopian tubes, and the second about how you can treat your blocked fallopian tubes and then eventually be able to get pregnant despite having blocked fallopian tubes. So it's well worth a watch. Also, certain STDs will lead to you not getting pregnant. Chlamydia, gonorrhea, trichomoniasis. You need to address these. So at the early stage of your journey of trying to fall pregnant, if you have some risk factors, that means that you are likely to have had an STD at some point in your life, get an STD screen done early. That way you will identify if you've got chlamydia or any of these STDs and you can get treated early. The importance also of finding out whether you have any of these STDs